Hi, I'm Dr. Brownfield, and I'm working at Grady Veterinary Hospital, and today we're going to talk about diabetes. Treatment for diabetes is very important, and all diabetics need treatment. So the first line therapy of treatment is actually modification of the diet. And it's important to feed a diet that's a little higher in fiber and has less carbohydrates, which break down into sugar. And it's also very important to get your pet on a routine schedule for eating, like twice a day, instead of letting them feed all the time, because insulin needs to be given when your pet is eating. The other reason that that's important is so that we know that your pet is still eating and it's okay and safe to give insulin, because there are serious consequences to administering insulin in a pet that has not been eating. So that's the first line of therapy. The second line of therapy is actually administration of insulin. And a lot of times when your pet is first diagnosed with diabetes, they're usually kept in the hospital and tried to regulate that way by administering insulin until we bring down their blood sugar level to an appropriate level. A lot of owners are intimidated somewhat by having to give their pets insulin at home. So a lot of times it's very important to go over that it's a lot easier than we actually think that it is, and giving your pet these injections really doesn't hurt them. It's a very small needle, and it's important to know how to properly administer insulin as well. So what I always tell my patients or my clients is to actually keep your insulin in the refrigerator. You don't want to freeze it, and you don't want to leave it out. When it's in the fridge, it can actually settle out, so you want to make sure you mix it up appropriately, but you don't want to vigorously shake it. You want to roll it gently between your hands in order to mix it well without creating a bunch of foam or air bubbles. Because when you pull that up and there's air bubbles in there, we can inaccurately dose them. So we gently roll that between our hands, and then we turn the bottle upside down and actually insert the syringe into the bottle and pull up the amount that's needed. And then you just tent your pet's skin and insert it just under the top of the skin and squirt it in and remove the needle. And most pets don't even really feel it. So that is a lot easier than most people think, and pets can be managed very well by their owners at home. It's important to continue monitoring your pet at home even after the initial visit and regulation in order to make sure that we're maintaining good control of diabetes. So it's important to watch for an increase in thirst, increase in urination, and an increase in appetite or weight loss, just like we were seeing, before your pet was diagnosed. And that's important to continue to monitor, because that can be the first sign that your pet may be slightly out of control of their diabetes and need to be rechecked. And it's also important that even when your pet is doing well and is eating and drinking and doing fine, to actually do routine rechecks with your vet just to make sure that all of the levels are appropriate. So if you have any questions or you're concerned that your pet may be affected by diabetes, then certainly don't hesitate to call your veterinarian and make an appointment.